What happens if you need to go to hospital? Looks like Josh here's about to find out. Josh's hospital experience depends on a few things. Why he's going, whether he goes to a private or public hospital, and whether or not he has health insurance. Let's talk about public hospitals first. You can go to a public hospital for elective or emergency treatment. Here's the difference. Let's say Josh hurts his knee in the accident and will eventually need an operation to fix it. That's elective treatment. It's necessary, but it can wait 24 hours or more. Now let's say Josh is bleeding from his belly. If doctors don't operate on him immediately, he could die. When he goes to hospital this time, it's an emergency admission. That part's pretty straightforward. So now let's have a look at what happens next with that emergency. When Josh gets to hospital, they'll ask him if he wants to be a public or private patient. If Josh doesn't have private health insurance, he's called a public patient. That means Medicare will cover all his costs, including his doctor's bills. The hospital will choose which doctors treat Josh, and he'll probably share a room or ward with other patients. If Josh does have private health insurance and chooses to use it, he'll be called a private patient, and Medicare will cover part of his doctor's bills. His other hospital costs could be covered partly or entirely by his health fund, and he might get his own room if there's one available. But Josh doesn't have to use his private health insurance. He might even incur out-of-pocket costs if he does. If this ever happens to you, check with your health fund if you can, or to be safe, tell the hospital you'd like to be a public patient. That's emergencies covered. Let's see what happens with elective hospital treatment. Now, Josh can get his knee fixed at a public or private hospital. He goes public. Here's what happens next. As a public patient, Medicare will cover the cost of Josh's hospital stay. He won't be able to choose his doctor or the hospital he stays in. He might have to wait for his operation on the public hospital waiting list, and he'll probably have to share a room. If he's a private patient with private health insurance in the public hospital, Medicare will cover part of Josh's doctor's bills, and some or all of the rest of his hospital costs could be covered by his health fund. He'll probably get to choose his doctor and hospital. He might still have to wait on a public hospital waiting list for his operation, but he might have a room of his own. Once again, it's a good idea to have a chat with your health fund to check you'll be covered before you decide to use your private health insurance. So that's public hospitals. But you can have elective treatment at private hospitals too. So how do you decide where to go? Say Paolo here has a nasty hernia which needs an operation. He needs to think about things like how long the public hospital waiting list is and how soon he wants his operation, whether he has private health insurance and how much of his treatment costs his private health fund will pay, whether he wants a particular doctor and which hospitals that doctor works at. That's a lot of thinking. Paolo has private health insurance and calls his health fund and doctor for advice so he doesn't have to make the decision alone. He chooses a private hospital because his hernia hurts and he wants it treated soon. At private hospitals, there's no public hospital waiting list. Remember, Paolo has private health insurance, so Medicare will cover part of his doctor's bills and some or all of the rest will be covered by his health fund. He can choose his hospital and doctor, he might get his own room, and of course, he won't have to wait on the public hospital waiting list. Even if Paolo didn't have private health insurance, he could still be treated in a private hospital. He'd just have to pay for it himself. It's called being a self-funded patient. Medicare would pay for part of Paolo's doctor's bills. He'd have to pay for everything else himself, and that could add up to thousands of dollars. So, that's how it goes. You can go to hospital for emergency or elective treatment. If it's an emergency, you'll probably go to a public hospital where you can be admitted as a public patient, or if you have private health insurance, you can choose to be admitted as a private patient. If you need elective treatment, you can go to either a public or private hospital, but you need to think about some things before you decide. There's a lot of stuff to understand, and if you want more information, check the Going to Hospital section at nib.com.au. But it's probably just best if you stay healthy. And take care if you're skateboarding. So maybe you won't have to go to hospital at all. See you later.